Hello everyone, Thomas Weimbs here. I'm the President and Chief Scientific Officer of Santa Barbara Nutrients. I wanted to present to everyone our brand new Scientific Director of the RenNu Program, Melina. And Melina, who are you? What's your background?
Hi everyone. I'm really excited to join the RenNu Program and lead it. And I am actually a postdoctoral fellow in the Weimbs Lab. I joined the Weimbs Lab as an immunologist, but I also joined them because I am a PKD patient myself with an extensive family history. So I'm both scientist and patient, and I want to bring that to the table both in the Weimbs Lab and at Santa Barbara Nutrients.
Great, super. And by Weimbs Lab, you mean, of course, our research lab at the University of California, Santa Barbara, which is where we are at right now. That's the beautiful campus here. Some lazy students in the background. They're not from my lab. So Melina, so you're a postdoctoral researcher. What does that even mean? What is a postdoctoral researcher?
Yeah, so I completed my PhD training actually up in Canada. And then this is the next step in an academic career towards hopefully one day my own faculty position and running my own lab. I get to explore a new lab environment, do new research, and actually, in my case, join a little bit of a new research field. In my case, the kidney disease, because I didn't study that previously, but I'm hoping to apply my immunology training to studying PKD and taking that throughout my career.
Super. We're very happy to have Melina in the lab because she's really an expert in immunology, trying to understand in our lab now what the immune system does in polycystic kidney disease and how it responds to ketogenic metabolic therapy, things like that. But since you also have PKD, and maybe you can tell us a little bit about the background. So it's I understand your whole family is affected, or many family members.
Yeah. So my dad has it, and his sister, so my aunt, and then also my brother and myself. And we are all, we were always told that it's, as many of you know, it's a genetic disease and there's nothing we can do up until the point you need dialysis or a transplant. But then in 2019, we came across the Weimbs Lab really groundbreaking research about the ketogenic diet and KetoCitra. And we started implementing those changes pretty much right away. And then in 2023, I actually joined the RenNu Program because I was so convinced already from all the little health changes that we saw in our life. And I joined the program, and it has really fundamentally changed my own health, how I feel every day. And it has changed also my family's health a lot. And ever since taking the program, I live the ketogenic lifestyle. I take KetoCitra every day, and I am now super, super excited to lead the program and show other patients what this program can do for them.
Mm-hmm. Wow. So you as a scientist, you read papers, and you found our paper or our papers. Starting in 2019, when we published, about ketogenic metabolic therapy, but also about microcrystals and their role in PKD progression. And you decided to just take matters into your own hands and do it, right? So based on those studies, all right, that's not necessarily recommended for everyone out there, but Melina, is a trained scientist and was able to just implement it, and things worked out really well. And then we got to know each other, and you got to know the RenNu Program, and I think I might have suggested, hey, do you want to be in it or something?
Yeah, you did, for
right.
Sure.
And then so you did. So you went through the whole RenNu Program. So what was your experience as a participant in the RenNu Program? How did you like it?
Yeah, so I don't think I could have made the lifestyle changes I made without taking the program, because I probably similar to most people who first come across this research, it seems really overwhelming and confusing. And you hear there's dietary changes, there's good and bad foods, but you don't really know where to start. And am I doing more harm than good here? And so going through a program where they, step by step introduce you to the nutritional changes and all the benefits that they bring, and they give really detailed guidance in terms of recipes and teaching modules, and also one-on-one contact with a dietitian. You get really taken through the whole process, and by the end of it, you don't even have to think about it anymore. It's become habits, and now this lifestyle, it's a lifestyle. It's no longer a program or a diet. It's just my life. And having a program like this that does it really in a step-by-step, slow manner is, I think, I couldn't have done it without it. You will encounter challenges for sure. It is, you're changing fundamentally how your body is processing different nutrients, and maybe you go through a few months of feeling tired, or you maybe lose weight at the beginning, but after some time your body gets used to it, and you learn all the tools and the skills to interpret nutrition and learn how to fuel your body in the right way. And I can only highly recommend it for anyone looking to do this lifestyle change.
Good. So that sounds amazing. So you went through the whole program, start to finish, and it's a pretty intensive program. 3-month program. It's kind of like a college course almost, right? We're college professors here on a campus, so we know how to do college courses. So what did your I'm wondering, was your doctor suspicious, or did you even talk to a doctor at all?
Yeah, I did. I tried to. I had since then I've had 2 different nephrologists because I moved countries, and both of them were actually not very interested in learning about it. And that, I told them about the success I had, and the various strategies that are out there, like the ketogenic diet, but also taking KetoCitra. But in my experience right now, there isn't a lot of interest yet, and that's something I would love to change, and that's why I'm also here. Being both scientists and patients, maybe I can bridge that gap that we currently have, and voice to the clinical community the real scientific basis that this program has, and that it's not just a random diet approach that you find plenty of out there. It's actually scientifically backed, and many people have already shown, just trying it on themselves, that it has more improvement than any other drug out there has ever done for PKD. So it's really working for many patients, and it really should be first-line treatment for anyone that first comes to the clinic with PKD. So I hope to bring that to the clinic and change that over the next few years.
Wow, excellent. So what were some of the changes, the beneficial changes you have experienced, and maybe some of the other people in your cohort going through the RenNu Program have experienced?
Yeah, so for me personally, it's maybe a little bit different than some of the other ones that were there, because I still had full kidney function when I joined. I'm still on the young side for PKD progression, so my kidney function hadn't changed. But of course, I have already pretty big kidneys, and the cysts are growing. At least they were in the past. And the first thing I actually noticed was a reduction just in that discomfort and the pain in the side. And during exercise, for example, that pain isn't really there anymore. And a stabilization in blood pressure, that was a really great benefit. And I haven't gotten sick anymore at all since I've taken the RenNu program, because every meal that I eat is very nutritious, and I corrected any sort of deficiency that I had, because I learned how to fuel my body in the right way. So I just overall have a much better immune system and a much lower inflammation in my body. And then I do get my kidneys measured every now and again with ultrasound, which isn't the most accurate measurement, to be fair, but I haven't seen my kidneys grown at all, even though before they were steadily growing. So that is very preliminary data, and I still need to follow up on it, but it's the first sign of improvement for this actual disease. So I'm really, really excited about it.
Wow, excellent. And speaking of data, so you're a scientist, I'm a scientist. We're of course very interested in data. So we want to know, the outcomes. And we're doing clinical trials. Do you want to talk a little bit about the clinical studies that are ongoing and being planned? What are we trying to get out of it?
Yeah, for sure. So of course, one way to convince the clinicians that this is working is to do these clinical trials where over a longer period of time, we can show that there are not just improvements in patients, comfort levels, but real values, right? Like that the kidney function improves and that the kidney size decreases. And so there are now multiple clinical trials either in planning or already ongoing that are trying to test this. And they're using the RenNu program, so the program we developed, and also KetoCitra along with it. Get these patients to take the program and then also follow up with these patients for multiple months afterwards to see how are they doing. Is this something that is sustainable for the rest of their life? And most importantly, do we see changes with the kidney function and size? And there already was one 3-month trial completed in Germany that just was 3 months of a feasibility trial to see if patients even tolerate this type of program. And even in those 3 months, we already were able to see improvements, which was actually not what we expected. We thought 3 months was too short, right? We thought we would maybe just learn that the patients were doing okay on the diet or were maybe feeling better, but we didn't expect changes in their kidney filter rate or their kidney size, but we actually saw both, which was very surprising. And so we can't wait now to get the 6 months and the 1 year follow-up from all the ongoing trials to see if that is just a trend that keeps going. And yeah, it's really exciting, and I personally have no doubt that we're going to see really, really surprising or, well, expected but incredible results,
Good, excellent, yeah. So one trial that's in full swing right now is at Juntendo University in Tokyo in Japan. That's led by Professor Shigeo Horie over there. And it's just, wonderful to work with them. Another trial we're putting together will be at the Cleveland Clinic. So Melina will, of course, also be involved in that. And in addition, we're also keeping track of the outcome data of just regular participants going through the RenNu program, which will be, that's kind of like a real-life study, if you will, right? So under real-life conditions, regular people with polycystic kidney disease, right, like Melina, going through the program and seeing what happens, before versus after. And then, of course, also longer-term outcomes, as time goes on. Great. So, Melina, yeah, thank you very much. I think everybody will hear much more from you going forward. But for the moment, here's the introduction. All right. Great. Thanks a lot.
Thank you.